Hi, my name is Christina Clement, and I'm a nursing student with U of M Flint, and I'm here today to talk to you about the flu and the flu vaccine. Thank you for having me at the Lincoln Golden Ages Senior Center. It's really great to be here. I am a lifelong Lincoln community resident. My dad graduated from Lincoln, and I graduated from Lincoln. And my son is currently in 8th grade at Lincoln. So it is good to be here. Before we started, I gave you a short little quiz, and we'll take a little quiz at the end to see if you learned anything. It's mostly for to grade me, not you, so don't worry about your answers. So what is influenza? It's also known as the flu or the seasonal flu. It's highly infectious. It's a respiratory virus. It's often more severe than other respiratory viruses. You will notice symptoms 1 to 4 days after you're exposed. Spread is through respiratory droplets. Most people will recover in 1 to 2 weeks. The typical treatment is rest, fluids, fever reducer, pain reliever, and antivirals, also known as Tamiflu. The signs and symptoms are fever, cough, sore throat, runny or stuffy nose, body and muscle aches, headache, extreme fatigue, and occasional vomiting and diarrhea. Does any of that information sound familiar? It should, because a lot of it is similar, very similar to the COVID-19 virus that we're also dealing with right now. Why should you be concerned about the flu, and who is at increased risk? Well, adults 65 and older are at increased risk just because you're older and your immune system isn't as strong as typically it would have been in younger people. Add on that, if you have any other chronic conditions, like respiratory conditions like asthma or COPD, neurological conditions, blood disorders, endocrine disorders like diabetes, heart disease, kidney disease, liver disorders, if you're overweight, if your immune system is weakened because of cancer treatments or HIV, if you've had a stroke, if you're pregnant, if you're in a nursing home or long-term care facility, and then also racial or ethnic minorities are also at increased risk. So, we talked about on the previous slide that most people recover within 1 to 2 weeks, and that is true. Like the COVID virus, most people will recover, but there are also some very serious complications. Sinus and ear infections, pneumonia, inflammation of the heart, brain, or muscles, multi-organ failure. You could have an extreme respiratory response that could lead to sepsis, which can lead to death. And it can also make the chronic conditions that you have worse. So it could be pretty severe for some people and even cause death. Here's a little video we're going to watch.
The COVID-19 pandemic has brought huge public health challenges. CDC is preparing for both flu and COVID-19 to spread this fall and winter. Everyone has an important role to play this flu season. If you have to be out and about for your job as an essential worker or to make a trip to the grocery store or your doctor's office, take action to protect yourself and others from respiratory illnesses like flu and COVID-19. Mask up. Wear a mask over your nose and mouth. When in public, keep a distance of at least 6 feet between yourself and others when you can. Lather up. Wash your hands often with soap and water. If soap and water aren't available, use an alcohol-based hand sanitizer. And roll up your sleeve and get your annual flu vaccine. This season, a flu vaccine is more important than ever to reduce the risk of flu for yourself, your family, and your community. It can also reduce the burden of flu illness on the healthcare system and save medical resources to care for people with COVID-19. The more people vaccinated, the more people protected. Get your flu vaccine to protect yourself and your loved ones. To learn more, visit cdc.gov/flu.
So what can you do to protect yourself? The best way available right now to protect yourself from the flu is the flu vaccine, which is available for anyone ages 6 months and older. It will protect against the 3 to 4 strains that have predicted to be most prevalent this year. So it will vary year to year of what strains of the flu it will protect you from. So that's why getting one year doesn't protect you. The next year you need to get a new injection every year. And it may not prevent you from getting the flu 100%, but it will most likely increase your chances that your symptoms will be really severe. If you do get the flu, it will be a lot milder than if you did not get the flu vaccine. Many of the other things we can do to protect ourselves are the same for the COVID virus: washing our hands, not touching our face, avoiding people that are sick, and a good way to protect yourself from any virus is to make sure your immune system is healthy by eating your proper lots of fruits and vegetables and getting exercise. Who should not get the flu vaccine? A majority of people can get it. They do not give it to babies under 6 months of age. If you have an allergy to something that's in the vaccine or its ingredients, we wouldn't want you to get it. So if you have some allergies, especially to egg, have had Guillain-Barré syndrome, or you're not feeling well that particular day, talk to your doctor. They may or may not give it to you that day. Will the flu vaccine give me the flu? This is impossible. The flu vaccine cannot give you the flu. The virus that you're injected with has been inactivated or killed. So it cannot multiply and spread and infect you. You may feel sick after the flu, especially have a mild fever, a headache, muscle aches, and that should begin soon after you have the injection and last maybe 1 to 2 days. And that's because, you have been injected with the dead virus. Your body recognizes it as something that it wants to attack and builds those immunities up to it and against it. But, so then that's what gives you the protection, and you can't get the flu if you're exposed to the flu because your body already thinks it's been exposed to it. But that virus that you were injected with can't multiply and spread and make you sick. Is it safe? They started doing flu vaccines over 50 years ago, and hundreds of millions of Americans have safely received it. Some common side effects we talked about were the headache, fever, muscle aches. You can also be nauseous. You can have soreness or redness of the swelling or swelling of the injection site. If you have an allergic reaction, you're going to want to seek medical treatment. So if you have difficulty breathing, hoarseness or wheezing, swelling around the eyes or lips, hives, paleness, weakness, fast heartbeat or dizziness, you're going to want to probably call your doctor's office or head to the ER. So we're going to do a little post-test. Questions are basically the same with the exception of the first one where I'd like you to answer whether you're more likely after this presentation to get the flu vaccine if your mind was changed at all. And like I said, the quiz is not really to grade you, but really to grade me. And, was my presentation, did I present the right material? Did I present things, in a way that you can understand them? Just to give me some feedback. So thank you very much, and go get your flu vaccine. So, my intended audience were ages 65 and older at the senior center, mix of male and female. The township that the senior center in is 81% Caucasian and like 7% other or mixed race and 4% African American. So the makeup is probably we're going to be primarily Caucasian with a few minority members maybe. So I chose this topic to increase the proportion of people receiving the flu vaccine every year. It's based on the Healthy People 2030 objective of having 70% of people aged 6 months and older receive the flu vaccine. Currently, or the statistics from 2017-18 showed that 49.2% of persons aged 6 months and older received the flu vaccine. So there is definitely a lot of room for improvement. And I chose the older adult population because they are definitely at increased risk for complications of infection and death. And I chose this topic because it's especially important this year due to the ongoing COVID pandemic, to really promote to everyone, every age, to go out and get the flu vaccine. So in my research, I ran across an article in a vaccine journal that that's titled, "Does Correcting Myths About Flu Vaccine Work?" I was like, yeah, this is going to be great. It's going to really back up, dispel those myths, and, people are going to go out and get their flu vaccine. Well, it really showed that most of the time dispelling those myths really didn't change people's minds all that much about getting the flu vaccine. So this was kind of disheartening. You could think, knowledge is power. Give people the facts and they'll see the light and do what we want them to do. But this study didn't really correlate that. So instead of really focusing my presentation on a lot of the myths and, I wanted to give them the facts, but not base my whole, I'm going to change your mind because of the facts, because this study shows that that's not really necessarily the case. So I wanted to make sure I kind of tried to portray myself as a trusting source, make a connection with them because I'm from that community. I wasn't someone coming in from the outside telling them this information. And then I also try to kind of empower them and show them that this is something they can do to protect themselves. Put it in their hands to kind of empower them and, give them the choice, and hopefully, with a combination of presenting facts and, forming a trusting relationship and empowering them, that would be enough to influence some that were unsure about it to go get it. Thank you.